How's it going? I'm Tyler Simonek. I'm going to talk to you guys about my iPOMP project that I completed with Michael Scott and Jeffrey Smith, which focuses on the effects of place-based disparities and early life stressors on health outcomes. It was an literary analysis aimed to identify research solutions that limit the negative effect of these particular factors. So with our project, place-based disparities refers to how an individual's environments, including segregation, neighborhood conditions, employment, education, and stress, all affect long-term health. These factors contribute to many early life stress, which is linked to poor developmental and health outcomes. Our analysis reviewed existing research to identify specific health effects caused by these disparities and examine the different research methods used to study them. The findings show that people living in segregated and poverty-stricken neighborhoods experience higher rates of chronic disease such as cardiovascular, hypertension, and asthma. Additionally, childhood exposures to stress in these environments lead to long-term negative health effects, including risk for psychiatric and immune-mediated disorders. So kind of going over our project, some of the takeaways we got were this project was one to identify health disparities research that historically followed two distinct approaches, which is one was a population-based epidemiological approach and the animal-based biomedical research. While both offer valuable insights, they lacked interdisciplinary collaboration, which limits the ability to transfer these identifiable causes and resolutions into effective solutions. This was a big realization for our project, realizing that improving health outcomes requires not only focusing on the problem, but also the implementation portion of that aspect. Research should also look into different ways to integrate and use a multidisciplinary approach that focus on these interventions, such as place-based initiatives and health impact assessments to address the root cause rather than just the symptoms of the disparities. If I were to be chatting with another student, I would give advice to work on similar projects, would emphasize the importance of bridging the gap instead of just social science, where, seeing that they are distinctly separate and how they can implement across that bridge. Also focusing on actionable solutions is pretty crucial, and advocating for practical intervention that is driving the real change, looking for the root cause. Overall, it's really eye-opening to look at this, especially how environment can really impact your long-term health. Thanks for listening.